San Francisco has a reputation and I think a value of being a city that cares about the vulnerable, that cares about equity and fairness, that thinks of itself as somewhere where people in need get what they need. So that in some ways makes it more surprising that we have the inequities that we do.
These are communities that have historically been oppressed in a lot of different ways, where they've not had access to interventions.
Those differences do result in health differences down the line.
Looking at the Black community in particular, continue to have disproportionately higher rates of hypertension, diabetes.
We are trying to instill a mindset that equity, just like safety, is an integral part of our care.
When I think about our equity work, it's about how do we pivot away from what is wrong with you to what has happened to you. What is your story and how has your story led you to our hospitals today?
By looking through everything through the equity lens, we see how to potentially change our programs, our system, and I think most importantly, our culture.
Because of the health disparities, we recognized that we needed to do something. We needed to do something different and have some different intervention. So the Black African American Health Initiative was established.
BAAHI is designed to look at the disparities among African Americans in San Francisco.
We need to not only address the health inequities that we see in the community, but also the inequities that our staff experience internally.
The initiative also had a component of training, and that 32-hour training has actually been taken by over 600 staff in the department at this point.
That was a powerful transition for hospitals, making sure that every manager, director, and executive spent 4 full days in racial humility training. It was a very interesting time for self-reflection as an organization on our biases, on institutional racism.
People discuss something that is very much relevant to their own work and how they can use their own work to advance equity or health equity.
Having conversations around being more culturally appropriate is new.
Still, we're uncomfortable, but you're still having the conversations, and that's important.
There were some really heated exchanges, but everybody was okay at the end. They probably carried a little bit with them home. They probably talked about it with family and friends, but that's what we want. We want folks to be inspired enough, present enough to show up, to recognize that they're one part of this bigger picture here.
So one thing that we're saying differently when we start equity work is staff on their own initiative or asking the right questions to ensure that disparity isn't taking place.
I can say that, everything I learned in medical school probably is less important than I originally thought. And the social determinants of health and how we actually make everybody more healthy is probably more important than what I learned 25 years ago.
So the goals of the department around equity are still evolving, but the mandate of the Office of Health Equity right now is working with increasing community engagement.
It's almost like you're doing a clinic with no walls. It's going outside and actually going into the community. They talk about the things that they would like to see come to the various clinics.
We are actively looking at the Black populations and essentially going above and beyond to ensure that their hypertension is under control.
So we actually called all of our Black African American patients with high blood pressure to talk to them about having them see our health coach and our lifestyle clinic.
I've been with the center here for about 4 years. I'm 72 years old. I'm retired and I wanted to do what I can do for my community over here. By being out in the front, up working on a food pharmacy, when they come in, they have that respect for everybody.
We have over 60 patients every Thursday that show up here at our food pharmacy.
Some of the people is getting healthy, and I see most all of them getting healthy.
The more you educate your community, it's a better health outcome. We also have the barbershop, because that's where they gather, and talk about things.
Health is the new wealth, and it's very valuable.
We really try to focus on coming at it from a culturally sensitive standpoint. And that's why we're here, is to be able to provide a safe space for people to get the resources necessary in developing health and wellness.
My grandfather, when he finally went to the doctor, they told him he had not just one heart attack, but several heart attacks.
It changed my focus to realize that it's not that I just do this work because it is my community, but I'm doing it for a greater cause, because it is around equity. And it's okay to say, this is around equity.
I certainly think the community organizations and us have a much more focused idea on what it is that we're trying to achieve and how we can each play a role in helping each other.
Well, certainly I would say that these issues didn't happen overnight and they're not going to be solved overnight, but I think we need to hold ourselves accountable for making real progress in areas, and then from that progress learning where innovation has worked, changing what hasn't, and continuing to drive the work forward.